Hi everyone, I'm Sarah Rice, licensed professional counselor at Queen Counseling Center, and today we're diving into the cornerstone of trauma healing, the difference between containment and stabilization in dissociative identity disorder treatment. Let's talk about the foundations of phase one. In trauma therapy, we often talk about three broad phases of recovery: safety and stabilization, trauma processing, and integration and reconnection. Containment and stabilization both belong in the first phase. They're not optional. They're the ground we build on before we go anywhere near trauma memories. Without them, healing can feel like reopening wounds without a bandage. Let's talk about what containment really means. Containment is about creating safety through boundaries and structure, both inside and outside of therapy. In DID systems, different parts often carry different emotions, memories, or impulses. Containment helps make sure those experiences don't overwhelm the whole system. Think of it like emotional triage. We're not ignoring the pain, we're holding it safely until the system is strong enough to process it. Containment might look like using visualization, like imagining a safe room, box, or container for distressing memories, setting clear behavioral boundaries for parts that feel unsafe, creating predictable daily routines, or simply agreeing that not every thought or feeling needs to be explored right at that moment. Containment keeps the story from flooding you before you're ready to swim. Let's talk about moving towards stabilization. Okay, once containment is in place, we move into stabilization, and this is where healing really starts to feel possible. Stabilization is about regulation and cooperation. It's the process of helping your system, your nervous system, emotions, and parts stay steady, connected, and functional. So, containment keeps you safe, stabilization keeps you steady. Here's what stabilization often includes: learning grounding and co regulation skills, building consistent daily routines, sleep, meals, movement, connection, encouraging safe communication between parts, strengthening the internal self as observer who can say, "We're safe now." When containment is about not drowning, stabilization is about learning to float and eventually to swim. Why is it important that we can't skip these steps? Well, it's tempting to jump straight into trauma processing, believing everything will suddenly be fixed, especially for survivors who are eager to get over with it. But when we rush, we risk re traumatizing ourselves. Without containment and stabilization, trauma work can lead to emotional flooding, dissociation spikes, or even self blame. And that's not failure, it's your system protecting itself. Healing has to move at a speed of safety. I'll leave you with this. Healing from complex trauma isn't about speed, it's about stability. Containment is the safety net, and stabilization is the foundation you build your life on. Every time you ground, every time you choose rest instead of reactivity, that's healing. So follow for more information in regards to DID, organic DID, DID